And today is the 11th day of, no, sorry, today is the ninth day of November 2025. Yeah, how are you? Welcome, welcome. My name is Dr. Frederick Unwigbohai. I'm a licensed medical doctor, and on this program, we teach, we educate, we answer your questions. The program holds every Sunday by 8 p.m. to 9 p.m. Now, on today's program, we will be talking about cervical cancer. Cervical cancer uncovered. I felt it's important we talk about it because some people still don't know about cervical cancer. And I'm grateful that Dr. Israel is in the house. So I'm going to hand over this live session to Dr. Israel and then we'll continue. Dr. Israel, good evening. How you doing?
Yeah, and then final good evening. Happy Sunday. And happy Sunday to you all. Wednesday day with us today.
Yeah. Happy Sunday. Welcome, welcome. So, I just the start where you join. I say thank God, say you don't come, so that we will just start. They go like this, huh? So before we start fully, for those where they watch us, just tell us where you they watch us from. We are live on Facebook, on YouTube, on LinkedIn. Huh? So, Dr. Israel, over to you. I beg. May we just start. Yeah.
Okay, and today we did discuss about cervical cancer. Uh,
And what happened? What happened?
sorry. Today we did discuss about cervical cancer. And today we will try to talk a few things, important things when we know say you suppose learn. So we're not going to demand speak big English. We always keep on easy as we dey always dey keep am easy right from time. And for you wey don join us from now, remember say na from 8 to 9 p.m. now we dey do this program. We dey only answer questions, we dey only try to teach, but we no dey prescribe medication for here. Also, today we dey talk about cervical cancer. So if you ask question wey no concern cervical cancer, we no go answer, you. So just get ready to ask questions concerning cervical cancer. So all the women wey dey ask, make sure say you get question. And even though you be man, you get wife or you get sister, so get ready to learn and ask question. So wetin be cervical cancer? But before we talk about cervical cancer, wetin be this service, the cervical side before we talk cancer? Cervical na just service, and service na be the neck or the mouth of the uterus. The uterus na be the womb where pikin dey stay. So the mouth of that womb na we dey call cervix. That place where when the nurse or the doctor go chook am come talk say e don open, e don be 2 cm, e don be 4 cm, e don be 10 cm. Na that place na be cervix. Na that place na be cervix. And one of the problem wey cervix dey quick get na be this cancer, which is wey we dey call cervical cancer. So when we say cervical cancer, we dey talk about cancer wey affect the mouth of the womb, and wey affect mouth of womb, or wey affect the mouth of the uterus. Yeah, na be cervical cancer in a simple way. And as I said, cervical cancer na one of the cancer wey dey quick affect women. After breast cancer, the next thing na cervical cancer. So na make it dey very important make we talk a little about cervical cancer. Now, and if this thing happen, sometimes people no dey quick know say person don get cervical cancer, because sometimes e no dey get symptoms. Na until e don tey na sometimes symptoms dey come dey show. But one thing is say, if you quick know say you get cervical cancer, dem go fit treat am. Na only say most people no dey quick know say dem get cervical cancer, na dey make am dey tey, or come make some people come die, come kpai out of the disease. So na make we wan talk about am. One, as we don start already, make you for understand and also know what to do, make you for not make you for fit free yourself from this condition wey dey call cervical cancer. Now wetin be cancer now? Cancer na abnormal growth of the cells of the body, abnormal growth of the cells of the body. So with the normal body cell, dey get where dem dey grow reach. If dem don old, dem go die, dem go comot, new cell go come. Just like that, na so the body dey do am. But when we come say dis thing dey cancerous, e mean say that cell, instead of am to kpai come comot, e no go kpai, e go continue to dey grow, dey multiply, and dis thing go dey multiply anyhow. And when e don start to dey multiply anyhow, e go come dey affect every different part of the body. Na that time cancer go come set in. Or when dey don, as the cell suppose be, or the tissue suppose be, dey come dey see different changes from those tissue comot from the normal way wey e suppose be. Then you know say problem don dey dey. And dis thing dey happen small small, small small. No be say e go just happen once gbua. No, gradually, small small, na im dis changes dey happen. Na im dis changes dey happen. Na im make cervical cancer, if you fit quick detect am, even before the thing don change to cancer, if you fit detect am on time, you go fit treat am, and you go fit cure am. So when e never even become cancer, if you quick treat am that time, e no go even enter cancer. But when e don become cancer but you quick know, you go still fit quick treat am, then person go dey safe. Person go dey safe. Dr. Fred, so the next question wey we wan ask ourselves na wetin dey cause cervical cancer? Wetin be the cause of cervical cancer? Now, cervical cancer na one of the cancer wey e be say, yes, we even get something wey we know say na dis one be one of the thing wey dey cause am. Na that one na we dey call infection with human papilloma virus. So human papilloma virus na one virus wey dey fit affect human being, and e get different type. So dey get a particular type of dis human papilloma virus wey if you see am for person body, e mean say dis person fit quick get cervical cancer. There are different type of human papilloma virus. As I talk, dey get different type. So e get two of the types wey be say if you see am, you know say dis person go fit quick get go fit get cervical cancer. So once woman dey infected with dis HPV, which is human papilloma virus, there's every tendency say dis woman fit come down with cervical cancer. That is why we say make we dey always dey protect ourselves. And the funny thing is that this human papilloma virus, sometimes na through knacking na people take dey get am, and it's something that can be protected with just the use of rubber. You go even fit protect to get this virus wey we dey call human papilloma virus. So when you fit protect against that, you come see say you no go come down with the cancer. As I said, there are different types. So you still get the type wey fit give you genital wart and all those things. But today na cervical cancer na we dey look into. So continuous infection with human papilloma virus fit make somebody get cervical cancer. And people wey their immune system still dey very low, they are still very prone to cancer. So we go just use the opportunity fall into the risk factor. Wetin be all the risk factor? Wetin person go dey do wey go still make this person quickly get cervical cancer? One, people wey dey smoke. Women wey dey smoke, they go fit still quick get cervical cancer because e go reduce their immune system. Even people wey dey drink alcohol, they are still prone to coming down with cervical cancer. Women wey come notice, women wey notice say they don dey their menopause, but they come still dey see their menses, or they come dey see those red fluid dey come out from their body, all those people are still prone to come down with cervical cancer. So women na im dey quick affect. Na women na im dey affect because man no get service. Na only woman na im get cervix. Dr. Fred.
Yeah, thank you so much, Dr. Israel. You don't mention man no they get cervix and women get cervix, and you spoke about how people take and they get cervical cancer. If you dey watch us, if you dey hear us, share this video, invite your friends, and make dem come learn. Because I know that somebody talk say e get questions wey she wan ask about this topic. I don't know whether this person dey here right now. So we don talk how people take dey get am. But more just talk briefly. If woman get this thing for her body, how she go take know? I know say you mentioned am before. Most times she no go know at all. Say this thing don dey her body. By the time you dey realize, e fit don go very far. So for most women, we go talk say it's asymptomatic. E go just dey the woman body, dey cause problem, and she no go know. And even if e dey give her sign, she no go take am seriously. Example, the woman fit tell you say, doctor, anytime wey I meet my partner, I dey see blood dey come out. And we go tell this woman, say, Madam, oh, if you meet your partner and you notice bleeding, hurry up and go to the hospital. The woman no go gree. She go sit down, dey ask for questions on internet. Do you understand? Sometimes she fit get some kind discharge, we go get different color, we go dey smell, and so many other symptoms. So when we talk about that one, and then if anybody get question, make the person ask us. Then we'll talk about the diagnosis, talk about how to prevent them, because it is this cervical cancer, it is preventable. Oh. I don't know whether you mentioned Dr. Israel. Cervical cancer is preventable. It's a preventable disease. So if you they listen to us right now and you don't even know anything about cervical cancer, no, say this cancer now cancer where you feel prevent, make you not enter your body. But if you lose guard, if you not pay attention, if you no follow advice, medical advice, God forbid, the matter fit turn the other way around. So let's just break it down quickly. For Israel, we'll talk about some of the symptoms, and then how we will take note. Say,
Okay. Okay, Dr. Fred already talked one or two of the symptoms. In fact, the first thing I be say, you remember I first talk and said when person don't they get this thing at first, if he never know, and now that what they call asymptomatic, this person if not just get any symptom at all. And this one might be the early stage of the disease. So during the early stage, people know they get symptom. Now when the thing don't they take, now sometimes people come they get symptom. And one of the first symptom when the person go start to dey notice, now be say when you dey make well, when you dey meet your partner, you go come dey feel pain. You go dey feel pain. Another sorry, the first one now you go dey see blood. You dey after you meet, you see blood go come out. Then another one you come be say you come dey you feel come dey if you be person wey dey see your menses, in between your menses you go see bleeding, and you go dey see blood again. You don see your menses pass, oh, you come still dey see blood. And then I say another sign. Another one I be say you no dey see your menses again, you don enter menopause. Those people wey don dey their when they dey within their when they dey their menopausal age, they no dey see menses again. They'll come back say they'll come start to dey see menses again, or they see bleeding again, which is not supposed. And then they'll come dey get pain. Some women when they dey knack, they'll come dey feel pain. Pain during knacking and pain after knacking. And when you come dey notice all these things, e show say you go check yourself, and make you go check yourself. We know say yes, there are some other things wey fit be wey fit lead wey you fit see get wey go cause all those things, but e show say it is time to actually check yourself. Then you come dey get some kind unusual discharge, and for women from your body, things go dey discharge go dey come out, and sometimes this discharge go fit dey watery. um and sometimes they'll get some kind different funny color. So sometimes e go fit dey pale and all that, and e go dey smell anyhow. E go dey smell anyhow. You fit don take many drug, take a lot of antibiotics, and still you still dey notice am. Then you know say some things don change oh. Things don change. Then another thing be say most people, because this cancer, if when e don affect the cervix, e dey spread to other part of the body, mostly when e don take for the body. So the stages, the cervical cancer get different stages, but that are not concerning us now. More just they talk and they go. So as the stage, as the cancer don dey take for the body, the cancer come dey spread. The cells, you know say I say the cells dey grow anyhow, dey come dey spread, dey go other part of the body. And they get, and this part of the body where they quick spread go one and the lymph nodes. The lymph node now, all those, okay, then wetin I fit explain lymph node. Remember sometimes when you get injury for leg, you come notice say one part of your waist side dey pain you, or something come swell for there, dey pain you small. That thing wey swell for there na lymph nodes. Dem dey try to make sure say infection no enter. So that all those kind of lymph node dey different part of our body. E dey almost every part of our body. So that na one part, one tissue or one organ wey dey first dey infected, wey dey first dey infected by this cervical cancer, by this cancer. So the lymph node can be infected, your liver can be infected, the lungs can be infected, and the bones can also be infected. So this woman will come with waist pain, abdominal pain. You say e waist dey pain am, bone for the waist dey pain am, and low back pain. So they go dey get all those symptoms. You know, when e don affect the lungs, you feel dey get difficulty in breathing, the liver, the stomach go dey pain am, belle go swell. Also, this woman no go, this person no go fit eat. E no go dey get appetite to eat, or when e eat small food, e don belle full. When e eat small food, e belle don big. Another thing, you come dey lean. You go come dey lean. Now, this person when dey lean, no be say na because the body be dey try to produce some kind of cytokines. We call them cytokines, some kind of soldiers wey suppose help am fight. But these soldiers, dem dey quick chop fat comot for person body. So because dem dey quick chop fat, as dem dey chop the fat, the person, even though e dey chop all the food wey dey this life, the person go dey lean, dey lean, dey lean. So when the person start to dey see all these things, unusual bleeding and all that, man, e need to go do a lot. E need to go do test. E need to go find out wetin really dey happen. Remember I said no be only cervical cancer fit get all these symptoms, but once you see these symptoms, when you notice all these symptoms, abeg, it is time to check whether the person get, whether you get cervical cancer, or whether you get any other disease wey dey resemble am. And some disease, when some condition wey we dey mistake with this cervical cancer, there are some condition wey we dey mistake with them. One na UTI, urinary tract infection, because of the discharge and because of the pain during urination and the pain during all those things. Some people go think say na disease wey dey follow knacking, sexually transmitted, that is STI. Some people go think say na im dey get. Because of the bleeding and the heavy, sometimes some persons go get heavy menstrual flow. Their menses go come dey very heavy, and to the extent say the number of pad wey dem dey use go come increase. Some people go dey get those ones. So some of them go still dey think say na uterine fibroid na dem get. Na dem get. And another condition dey wey dey really dey share symptom with a cervical cancer, and that one dey call endometriosis. So sometimes people go dey think say na all these disease na dem get, whereas na cervical cancer. That is why it is very good. It is very good to test yourself, to check yourself. Once you get these symptoms, when you notice all these symptoms, check yourself about for all these diseases wey we just mentioned, so that make dem know which of them be the real one. Now, with Dr. Fred talk am just now, cervical cancer is preventable. That is, it is something wey we fit make sure say e no happen to us. And make I talk say even before we notice am, before if the cancer come become cancer, if you notice am on time, you go fit cure am. So it is preventable and it is curable when noticed on time. When noticed on time. But I always say most of the time before people present, the cancer don go far. And because the cancer don go far, then we no go fit treat am again. We no go fit treat am again. Okay, when we dey talk about prevention of cervical cancer, we get so many things wey we fit talk about prevention of cervical cancer. So na this one go come bring to our screening test. There are some screening tests wey you need to dey do. Apart from the screening test, there is even a vaccine that person can take to prevent them from coming down with wetin fit cause this cancer. Now, for the HPV, the human papilloma virus, when I say na im be the main culprit for cervical cancer, there is vaccine against am. And also there's a test that you can use to test whether you don't get the virus for your body. And if you don't get the virus for your body, so that you go know what and what you go fit dey do, so that make e no come lead to cancer. Make it no come lead to cancer. And we still get the one wey e be say you go dey check the lining of your of the cervix, na that one we dey call pap smear. So that if there's any change in the lining of the cervix, yes, in the lining of the cervix, then we go quick address am so that the person no go come down with cancer. And that test wey you go do to look the lining of the cervix, na we dey call pap smear. It's a screening test, we dey call am pap smear. This one na when woman go just go, they go collect from inside this, use something take like brush or something take clean the cervix, then carry am go lab, go test am, then to check whether the cells wey dey there still dey normal, or whether there's any abnormal cells, or whether the changes don too much. So then they go know what and what to do for you. And for women wey don dey sexually, wey don dey knack, they are it's very good for these people to dey do this pap smear at least once in every 3 years. Once in every 3 years until you reach age 65. Until you reach age 65 or age 65. Then when we talk about the HPV screening, that one na to test for whether person don get the virus, the HPV virus, that is the human papilloma virus, and which type the person get for body, so that make person for know how to address the issue, or how to check, how to make sure say this person no get problem more than how e be. And we still get the one wey dey call VIA. This one na to visualize the cervix, or put some kind chemical, and if the chemical change, e get as the chemical go take change, they go know say, oh, there's a problem with the cervix. And when they notice that problem, they can actually use something to quickly help the cervix at that process, at that moment, so that make the cervix, make it for not come change to cancer. Make it for not come change to cancer. So these are some of the screening tests wey person fit do, wey go take prevent am from coming down with cervical cancer. Then we come go to HPV vaccine. HPV vaccine dey available. E dey even this country Nigeria, and e dey so many, e dey almost everywhere for the world. And it is very important for our young children, young girls of 8 years, 10 years, may we give them this vaccine, because the vaccine dey work very well for people wey never start to dey expose themselves whenever they knack. However, even people wey don dey knack, women wey don dey knack, yes, the vaccine still dey for you to take. But as I said, e dey work very well for those wey never start to dey knack, because they fit never expose themselves to HPV. So we give those vaccine to protect them, so that make this HPV no enter their body. We remember one time when this vaccine just first new come, we dey hear different story up till today. We dey hear different story about the vaccine. Say the vaccine na to do this, the vaccine na to do that. People wan use am take control birth, this thing. They want to do it like to so that make our girls no dey born. They want to do this to control our population. All those things no be true. The vaccine na to protect our girl child, our female child, against this disease wey fit take their life without telling them anything, without even giving them permission. You no dey even tell them anything, e fit take their life. So if you get a female child at the age of 8, 9, abeg, carry am go health centers and all that, or places wey you know say dem dey give this vaccine. Make you vaccinate your child against HPV. And if you be woman and you never still take the vaccine, you fit still go ask if dem get the one for adult, dem go give you. But if dem no get, it is time for you to dey do your pap smear. If you dey do your pap smear, to dey check am every 3 years, so that if there is any change, you go quick handle am, so that make e no come change to cancer. And even when you see am, e come be there is a change like cancer, but e just a new start, they go also fit quick manage am, quickly treat am, so that make dem for fit cure am, then you go dey alright. Dr. Fred.
Thank you so much, Dr. Israel. Thank you very, very much. Now, if anybody you dey watch us right now and you get any question on this topic, oh yeah, drop your questions right now. Ask your questions so that may we see whether we go fit answer your questions. But before you ask question, make I first ask right now for all the women watching this live session. You don't do your cervical cancer screening, you don't do your pap smear, or you don't do your HPV testing, DNA testing. Which one you don't do? You don't do them? Yes. Which one you do? You never do them? Why you never do them? What will be the reason we make you never do them? Okay. We get some questions here. I go take the question and then I go read the question and Dr. Israel go respond. So yes, if you get questions, start asking the question right now so that we go respond to you. So there's a question here. It says, what is the name of the vaccine for adults and children? And please, is it free? Your mic is muted.
Sorry. The name of the vaccine is HPV vaccine. Just tell that HPV vaccine. Whether e free, I no fit tell you yes on that. E now depend on the place where you dey go. Most of the time for children, I think it's free. But as I said, it now depend on where you dey go, which health center you dey go, or which part you want for go take the vaccine. Now, when you reach there, sometimes dem fit tell you make you register, dem fit tell you to do one or two things. But even though e dey even though it's not free, e no go dey expensive. E no go dey expensive like that. So yes, the vaccine name na HPV vaccine.
Yeah, thank you so much. You've gotten the answer. The human papilloma virus vaccine. Okay. I dey try check. Let me see if I see more questions here. Ask now. No be say when we don't end the live session, you go call the disturb us. Let me see. Ask questions now for the ladies here. Please ask. Hey, I've been asked question before. Have you done your screening? You don't do your own screening, yes or no? If you never do, and why? Oh yeah, talk to me. So, Dr. Israel has given us a brief, I say brief, a total overview of this cervical cancer. Sure you get I thank God say he even come around today, and he came on time. Okay, I dey check, and I know they see question again. Oh, I know they see. Oh, let's see. No, you're asking us a wrong question today. We are not taking this question here. So let's take this question. It says, is there a vaccine for male children too?
Okay. The vaccine, they never really talk about any vaccine for male children. But now women, now they really talk about the vaccine, because when we talk about HPV infection, the problem where they cause mainly now women and the liquid that which is the cervical cancer. Yes, it doesn't mean say man of get HPV virus in their system, because sometimes na through as I talk, na through knacking na dey take dey collect am. So men fit still get HPV virus for their system. So most men wey dey even dey get all those genital warts and all those, some of them get HPV, and I make dem get those warts. Eh? Some of them get HPV, but for now they will not heard anything about any vaccine for male, but na only for female children, because of the cervical cancer. That's why we get for female children. So also let me we still talk so um if you want treat if you must meet anybody if you get multiple partner, I bet use I bet they use condom, so that you protect yourself and protect other people, other of your partners that are around and that are around you. Yeah.
Okay, so on that male children, let me add something too. So the thing be say, for this developing part of the world, for developing nations like us, the vaccine no dey enough for even the females. So they no dey discuss to give the males because we know say na majorly females dey come down with the problem. But for developed countries, countries wey be say get money, wey be say everything dey work, yes, they dey give their males as well. They dey give the boys the vaccine. But for low and middle income countries, resource poor nations, wey be say the little wey we get, we dey try ensure say na the people wey need am almost immediately na im take am. So na im make the conversation dey around the girl child. That does not mean that the boy child is not important. Na just say our government, people wey dey in charge of health, dey look am say dem no get money, and instead of them to put money for the right places, dem no wan do am. So na im make us dey talk about vaccines for the ladies. But for developed countries, they dey give their boys as well. Okay, so we have a question here. It says, what if person don get genital warts before, like 10 years ago, and it went away on its own? What test can be done to know if person get am?
So when person gets HPV, human papilloma virus, as I said, there are different types. You get the type when they cause what, you get the type when it cause the cervical cancer. So even when you don't get the what, person don't get the what 10 years ago and it don't go by itself, you still need to go check. You still need to go check which for the HPV to see which type he gets. Whether he get the mixed type in the sense that they get the type when it cause genital what and also get the type when it cause cancer, he need to know. And also, he also need this person, if na female, need to dey do pap smell. You need to dey do pap smear to dey check the cervix all the time. Or this kind person, I go say every 2 2 years, so that if there's any change, e go quickly handle am before anything. Now another problem is say even the human papilloma virus infection, e no really get cure. It's just that the body immune system dey fit handle am. Na im make some people go get genital wart, after some time e go disappear and e fit no appear again for a very long time. Why? Because their immune system don handle am, don keep am in check, and their immune system never go low since then. If they get any reason wey go make their immune system go down again, that person fit come back, fit get that genital wart again, or fit get any other thing again. That is why it is very good, even though you don first get am, you notice say e don comot and the wart don comot, still go check to be sure whether na the one wey dey cause wart just dey alone, or whether the person get the one wey go fit still cause cancer, so that e go know how to manage himself or herself.
Okay, we have another question. This person, I think she didn't join us in the beginning. How safe is the vaccine? Can my 14-year-old take the vaccine?
Blessing, the Madam Blessing, the vaccine is very safe. It's safe, and your 14 years old can actually take the vaccine. I remember a few days ago or some weeks ago, somebody called me to ask if his daughter fit take the vaccine. I think the daughter is 8 years or so, and I said yes, you can take it. And so it is very very safe. It is very safe. Mhm. But remember, there's no vaccine wey no get small small side effect. I cannot tell you which is the side effect. But yes, it can be whenever they give the injection, it may feel pain, may feel a little fever, tiredness, and all that. But it is very safe.
Okay, we have another question here. This one is from Oluchuku. He says, I do have serious pain during sex. Which test can I do?
So doctor can say when you dey get pain during say I mention something. I said yes, even cervical cancer there are other disease condition wey dey mimic am, wey dey look like am, because all of them get different the same symptom, the same signs and symptom, which this one wey you talk na one of it. So if you dey get this, e show say you need to go hospital, go see your doctor, make dem schedule you for different investigation, different investigation. Na when you meet your doctor go tell you the test wey you go do. E go write am for you and you go go do am. But one of them go be your pap smear. Pap smear. Even though you no write am, tell am say doctor, I want to do pap smear. I want to check my cervix to be sure say cancer never enter. Yeah.
Okay. Thanks for the information. Is the screening expensive?
I know say because health for this country is pay from your pocket, everything dey always look expensive to us. Yeah. So I cannot really tell you if the screening is expensive. It now depend on where you are going to do it. But let's look at it. How expensive will it be to just screen yourself and know how safe you can be than the money wey you come use take dey manage or buy chemotherapy or buy all those medication when cure no come dey that time. So you will be surprised say the money wey you take do screening is cheaper than what we use to treat in the long run. So that's why we say prevention is always cheaper than cure. So I don't even though it's not really too expensive, but even though it's expensive, I think it's easy. It's also still cheaper than treating yourself. And I think it's still cheaper than treating yourself. And so please find out, go to hospital, find out. They go tell you what you need to do, how much it will cost you, and then you try and carry out the investigation.
Okay, I think this person just came. Is cervical cancer a life-threatening disease?
We don't mention the word cancer. You suppose to say cancer na life-threatening disease. Anything wey be cancer is life-threatening. And the only good thing about this cervical cancer is that it is curable when you notice on time. And when you notice on time, it is curable. But once it does spread, it cannot be cured again as at that time. So it's a life-threatening disease. In fact, studies have even showed that about 60, that people with cervical cancer have a life expectancy of 5 years. That is, if they get like 5 years to live if nothing is done about it. So that's to tell you that it's a life-threatening disease.
Okay, I hope you have heard though it's a life-threatening disease. This person says, Blessing says, no, I have not done the screening and the HPV test, but I've taken the first dose of the HPV vaccine. How many doses for adults? Doses, how many for adults?
Okay, I think when wherever you dey take am, they're supposed to tell you how many doses you are supposed to take. I think some vaccine, I think there are different type of the vaccine. I think one is just a dose, while one is like 2 doses that you will take. So it depends on the type you are taking and where you are taking it. So they will actually tell you how many doses you are supposed to take. And they are supposed to tell you how many doses you are supposed to take. Now, somebody they ask, say, apart from HPV, what are the predisposing factors for cervical cancer? I think we mentioned some of them. We talk say one predisposing factor, that's like risk factor. One when I not mention, I be person wey don't use contraceptive pills for a very long time. They use contraceptive pills continuously for a long time, fit come down with cervical cancer. We still talk about people when they smoke, people when they drink, they fit quick come down with cervical cancer.
Okay, we have this comment here. Please, when my 13 years collected it from school, she started having eczema all over her face. Others complained same in her school. What should I do?
Okay. And during that period, did you go back to the hospital? Did you go to the hospital? Sometimes when you have things like that, you go to the hospital and let the doctor see and see what is happening. Also, this kind of thing is what you report back to wherever the vaccine was taken, so that they go report on to NAFDAC and WHO, because we get what they call pharmacovigilance. When we say pharmacovigilance, we dey try to see any medication wey we take. Eh? Sometimes they go give us reaction when some people know when we not fully understand, or sometimes they go even give us reaction when we understand. We need to report am quickly. We need to report am so that they will know and start working on it, or look for other means to make sure say these things not happen again. And so that these things not happen again. So, and I believe say apart from your daughter wey get am, you say others complain am the same thing. Out of those others, you will still be surprised that there are still some persons within among those people wey not even get any of these side effects. So these are side effects, and side effects can happen at any time.
Okay, thank you. We are almost rounding up with the questions. It says, having itching in a private regularly, can it be a sign of cervical cancer?
Well, all the symptoms wey we mention, we not say na once you see those symptoms, you don get cervical cancer. We only say that when you see those symptoms, is a pointer that you should add cervical cancer screening or test as part of the things that you will screen or investigate for. And what we mention, we say bleeding during knacking, bleeding during knacking, bleeding in between menses, bleeding for those wey no dey see their period again, painful knacking, pain after knacking, waist pain, back pain, discharge. Discharge, we no put each children and discharge. However, you never can say never. Never can say never. When you notice anything that is very unusual for you, abeg, go hospital.
Yeah, I like that part you mentioned, go hospital. Huh? My daughter is 21 but hasn't known man. Can she take the vaccine?
Yes.
She can take the vaccine. You had the response, Madam Pat. She can take the vaccine. Please ensure she gets the vaccine as soon as possible. Okay, now before we continue, if you know that you have not shared the live session, please share quickly. Share. Oh yeah, share. Uh, oh yeah, share so that more people will come and learn. Do we have any more questions? I don't think we have any more questions on this. So, Dr. Israel, I can't see any more.
Okay, there's one question I'm seeing. I think it's from YouTube. Uh,
Which one?
yeah, it's from YouTube. It said, is
This one?
is hepatitis A virus same as human papilloma virus and hepatitis B virus? No, human papilloma virus is different from hepatitis A and hepatitis B. Hepatitis is one family of its own that have A, B, C, and other. While human papilloma virus is of its own, is different virus, and they are all different viruses. Yeah. Okay, so
Yeah,
we've
yeah,
seen
yeah,
a
yeah,
lot
yeah.
of questions.
Yes. Okay, Dr. Israel, please continue. Continue.
Okay, yeah, we've seen a lot of questions. A lot of questions on HPV, cervical cancer. Yeah, we dey happy. Say you people they ask all this kind of question. It shows say you really want learn, and it shows say yes, you are understanding what we wetin we dey talk for here. And one question when I dey see for here from YouTube as well, and I notice say e be like say na YouTubers na dey ask some question, na dey ask question more today. If be like say na there, I just dey see their question more, and it is very good. If you never share, abeg share this life. We know say we go soon end, but share this life. Person fit still learn, gain one thing in the next 15 minutes. Person fit still gain one thing. So share the life if you never share. And it is very, very important. So somebody is asking, can someone still take the vaccine even after having genital warts? Can someone still take the vaccine even after having genital warts? So for the vaccine recently, most of the when they first roll out that vaccine, it was for everybody. But after some time, then they come they try to tailor am down to the main people. And the main people when suppose take that vaccine na young children or young ladies, young girls. For I dey talk about Nigeria context now. Young girls wey never see man before, wey never knack, wey never do anything like that. Because one thing wey dey quick expose people to HPV, human papilloma virus, na knacking. Na im dey quick expose people. In fact, most people wey get human papilloma virus na through knacking na im dey take get am. So na im dey quick expose people to that. So that is why you give it to na im make dem tailor am say before the person even come dey think of knacking, make we give the vaccine to prevent am against the virus. That is it. So for person wey don get genital wart, e go good make e go make dey do the test and make e dey do the screening. And if e dey do the test and lucky dey say, oh yeah, you fit still take this one because of the cancer, then you take. But if dey say no, you no need am because you don already get HPV for body, you go know say you go just dey do the screening continuously. So for those wey no go fit take the vaccine again, that is the reason why the screening test dey, the pap smear, the HPV test, and the VIA, visual and all that. Na im make all of dem dey, so that when you dey check am, dey see say dey try to check if there's any change in the cervical cancer cells. If there's any in the cervical in the cervix, the cells of the cervix, if there's any change, you quickly treat am. If there is no change, you continue living your life.
Yeah, thank you so
Dr. Fred.
much. Yeah, thank you very much. I believe we don't really answer a lot of questions today, and I hope that those wey watch, if you dey watch this video after we don't end, you have to go and watch again from the beginning, so that you will gain a lot of information here. So, if we no get any more questions, I think it is best to say maybe we try to dey round up right now because we don't try, we don't explain wetin be cervical cancer, wetin dey cause am, wetin be the symptoms, how people take dey get am, and the way we go take know. So I go just allow Dr. Israel, we just do a brief recap. Gloria, Ivie Gloria, I see you. Uh-huh. I go just allow me to do a brief recap and then we round up tonight.
Okay, and before we even do the quick recap and round up, e go good if you never share this type, make you share am. And I also want to remind you, say, Dr. Fred get course on how to create content. If you be you're a person where they create content online and all that, then it go make sense. If you never get am, make you get am, and so that make you not spoil your page. You know, they always use that one they sing. So for those of you when they post a video, and there's difference between share a video, like you press that share button, that one is different. Say you just carry a video like say na your own, you go post am, if you fit damage your page. And we not want that for you. We don't want anybody who come dey call us or send us message, say abeg, my page oh, no. So please do the right thing. Get the course or go on YouTube, check, learn, so that make nothing for happen to your page. Also, if you know they follow us, try follow us. Follow us on YouTube, follow us on Facebook, on Instagram and every other social media. Try follow us, and so that you dey get first-hand information, first-hand lectures, so that you can be so you dey up to date. We go try to give you up to date information based on how we take know am. Up to date information. So that because that's it. That's how wonderful it can be. Also note, every information wey we dey give you today, it is correct today. By tomorrow, one or two fit change because research dey happen every day. Research dey happen every day. It is also good make you know that one. So that when you no come hear say today we talk say this, tomorrow we come say, hey, wetin we tell you yesterday? This is the new one. You come talk say, why you first tell me like that before? It is because as at that time when we talk am, that is the correct thing. But by tomorrow, anything fit happen. So just know say change in the medical field is constant because research dey happen every day. So make we do a quick recap now on wetin we don talk for today. So today we discuss about cervical cancer. We first of all look at the cervix itself, and we say the cervix na be the mouth of the womb. The womb, that is the uterus where pikin dey stay. We say that cervix, that place wey be say when dem dey check you, you say na 2cm, e don dey open, e don dey open. That place when the nurse dey check whether e dey open or not, na that place that dem dey call cervix. And because of the vigorous work, all the passage of born, all the pikin wey you don born, all the open, e dey also dey make that place dey quick get problem. And one of the problem wey e dey quick get, na im we dey call cervical cancer. I would say cervical cancer na one of the condition, one of the cancer, the second most deadly cancer wey dey affect woman after breast cancer. The next one na cervical cancer wey dey affect women. So women, only women na get cervix. Man no get cervix. So this message come be say na for women, but it is also very important say the men also listen because they get wife, they get sister, and they get mothers, so that they can actually tell them, and also they there too go understand wetin these women dey pass through. So we come say wetin be the main cause, wetin dey really dey cause this cervical cancer? Come say na one virus na will be the main culprit. The main culprit no mean say na only one dey cause am, but because almost everybody wey dem see with cervical cancer, when dem check am, dem see that virus. And wetin be the name of this virus? Na human papilloma virus, that is HPV. Na be the name of the virus. So when dem check am, dem always dey see that virus. So we come say this virus na im dey cause this cervical cancer. And HPV get different type. E get some type wey dey call genital wart. E get some type wey dey cause cervical cancer. Na make it is very good to dey check, to know which one the person get and to know how e go take follow am. Cervical cancer is preventable. Cervical cancer is curable. It is only curable when it is noticed on time. When it is noticed on time. So how person fit take know whether e get cervical, whether cancer don dey or problem don dey? The first thing wey people dey quick know, at first, if you never dey get sign, at first e fit dey asymptomatic. That time person no go know. That time na the early stage. However, if you don dey pass the early stage, the person fit come dey get dey see blood when e dey knack. Go see blood when e dey knack. After, if you come dey see blood even after you don see im menses. After menses, you just notice say you still dey see bleeding. Or woman wey no dey see menses again, wey don enter menopause, go come start to dey see their menses again. Then later, dem come dey notice say if dem dey knack, dem dey get pain. And sometimes even after knacking, dem go still dey get pain. Those one na some of the signs. Then dem go dey get stomach pain, waist pain, dey tired easily. Sometimes if dem eat small food, dem go dey shout say dem don belle full. Dem go dey lose weight. These are signs saying e fit be cervical cancer. So if you don dey notice all these things, abeg go hospital make you go check yourself. Now when we talk about the prevention, we say there are tests wey you fit do. We dey call them screening tests. We get the pap smear. That one na for women wey don already dey knack, and wey between the wey dey within the knacking age, reproductive age, wey dey within the reproductive age. So these women fit dey do this pap smear every 3 years until they reach the age 65. to just dey check whether there's any changes in the cervical wall, so that if there's any change, they go quick handle those change. Another thing na to do the HPV test, the HPV test to find out, is this virus in our blood or not. And the third one na to take vaccine, because HPV vaccine dey for women and for our young girls, our young daughters. So it is very good you give your young daughter this vaccine. E dey work very well for the young daughters because they never meet man before, they never know any of all those things. So e dey work very very well. Also it is also good for us to know say our boys fit still take the vaccine but because Nigeria we not too get so many resources to take cater for both the male and the female, na make we focus for the female alone. But if you no dey dis country, you dey outside the country and dem say make your male take, abeg give your male, because we said this HPV na through knacking na people take dey get am, so na STI, sexually transmitted infection. So another symptom wey person fit see, e fit come dey see discharge, different discharge wey you dey smell, sometimes e go dey watery and e fit dey many, very unusual form of discharge. So when people dey see all these things, you need to go do test. And also we answer a lot of questions, we answered a lot of questions based on wetin we think say we fit answer and based on how we take understand them. Yes, this screening test dem no dey free, but when you go there you go see say prevention is still cheaper than cure. E still cheaper than cure. How dem fit take treat dis thing? The surgery dey there, when e be say dem go remove the cervix or remove the uterus in full. Now we get chemotherapy, we get radiotherapy wey you fit still use take treat am. Also, if you even wan do dis cervical cancer screening, there's even a self test kit for HPV, wey e be say you go by yourself take the sample for your house, nobody go help you take am, you go take am by yourself and send am to lab. And when dem check am say see wetin dey, dem go come know what and what dem go do for you. I think this is the story, dis one na the story of cervical cancer wey we want make you know for today. Dr. Fred. Dr. Fred, you mute you mute.
Oh, sorry. Now, thank you so much for this perfect summary where you just give. I hope say you will watch, you learn, you gain something. No be say you just sit down for here, we just talk, go, you gain. No be say sickness go dey your body, go dey chop you, you no go know. I want to say thank you for watching. Thank you for sharing. Thank you for asking and spending your data here. The program now every Sunday, 8 p.m. to 9 p.m. Now we dey always dey here. Dr. Israel, any final words?
Okay, I want to say thank you for all of you who have joined us today, wey ask questions and wey listen to us. We not take you guys for granted. You guys have done well. You have done very well. As I said, if you know they follow me or Dr. Fred, please do well to follow us. That na the only thing wey you fit do for us. Just follow us, share our video, like our video, comment. Those are the only things wey you fit do for us. Also, those of you wey dey want talk to us, when we want talk to us, say, can I chat? No, no dey do chatting. If you want talk to me, we go send you mail. You go pay for consultation, and you go pay for consultation, and then we go talk as at that time. So nothing say not be say you all come our DM and no, you go pay for consultation and you go follow the information wey e give to you, pay for the consultation, and then go fit come talk as at that time. Thank you, thank you, thank you. As Dr. Fred dey always say,
Good life. Good life, in a sense. Thank you and have a wonderful day. Bye bye.